Hi there. Welcome. Another video from Monkeypox channel. We still have news from this bade epidemic with updates from BBC Health reporters and correspondents Michelle Roberts, James Gallagher, and Philippa Roxby. We're going to wrap up our live coverage now, but here's a recap what we've heard today. Another 36 cases of monkeypox have been detected in England, bringing the total number of confirmed cases to 56, the UK Health Security Agency says. The UKHSA says the outbreak is significant and concerning, but the risk to the UK population remains low. The spread of monkeypox is a containable situation, Dr. Maria Van Kerkhove from the World Health Organization says, but warns we can't take our eye off the ball. UK Prime Minister Boris Johnson says that so far the consequences don't seem to be very serious, but it's important that we keep an eye on it. The director of the EU Disease Control Agency has said countries should review availability of the smallpox vaccine which is used for monkeypox. Denmark and Scotland have recorded their first cases of monkeypox, meaning it's now been found in 16 countries outside Africa, including Spain, Portugal, the US and Australia. In the UK, anyone at the highest risk of having caught monkeypox should isolate for 21 days. 3 facts to remember. Monkeypox doesn't tend to spread easily between people and the illness is usually mild. Symptoms include a fever, aches, and a rash of raised spots that later turn into blisters. For most people it clears up within 2 to 4 weeks. Unlike COVID, monkeypox is spread through close physical contact with somebody infected, and we have tools, such as the smallpox vaccine, that can be used to help limit the spread. No plans for travel restrictions, Downing Street. Downing Street has said there are no plans to hold a meeting of the Cobra Emergency Committee over monkeypox, or to impose any travel bans. Asked about travel restrictions from affected countries before the 36 new UK cases were announced, the Prime Minister's official spokesman said, no considerations of that kind. What we're seeing at the moment is community transmission not linked to travel. We do have vaccines procured at significant numbers, but given the nature of this and how we know it's spreading, it's thought to be no clinical requirement for that sort of at-scale campaign. Why this is not like the early days of COVID. It is tempting to treat this outbreak of monkeypox as though we're in the early days of the COVID pandemic, but this is not COVID-2. We should expect cases to continue to rise beyond the 57 now recorded across the UK. But remember, monkeypox and coronavirus are different viruses that spread in different ways and will need different tools to control them. There are urgent questions that need answering. Why is the monkeypox virus spreading now? Has it mutated, or did it just get a lucky break? Will it fizzle out like other outbreaks, or will it take hard work to bring cases down? How many people are already infected? COVID was a highly contagious disease that spread through the air we breathe and could spread even if you had no symptoms. Monkeypox mainly spreads through close skin-to-skin contact, and its blistering rash is hard to miss. We should have the tools to deal with it. Case rise concerning, but risk to population low, UKHSA. More now on the rise in monkeypox cases in the UK, with 36 new cases in England bringing the UK total to 57. In a statement, the UKHSA said the outbreak is significant and concerning, but the risk to the UK population remains low. Its chief medical advisor, Dr. Susan Hopkins, urged people to be aware of any unusual rashes or lesions and to contact a sexual health service if they have any symptoms, as the virus spreads through close contact. A notable proportion of recent cases in the UK and Europe have been found in gay and bisexual men, so we are particularly encouraging these men to be alert to the symptoms. She thanked those who have come forward for monkeypox testing so far and who have supported contact tracing efforts. You are helping us limit the spread of this infection in the UK. 36 new cases bring UK total to 57. The UK Health Security Agency, UKHSA, has said it has detected 36 additional cases of monkeypox in England. The latest cases bring the total number of monkeypox cases confirmed in England since 7 May to 56. Adding in the new case in Scotland, that brings the UK total to 57. Scottish cases contacts offered vaccine. Not much is known about Scotland's first monkeypox case, but some details are now starting to emerge. We now know that the person is in isolation in a Scottish hospital in an area which specializes in infectious diseases. They were exposed to the virus in the UK, and their close contacts are already being contacted and offered the smallpox vaccine. Dr. Nick Finn from Public Health Scotland says you'd expect to have between 10 and 20 contacts for each case of monkeypox, and says a more than sufficient. We'd love to hear from you in the comments section below. Thank you for watching. If you like the video, please consider liking and subscribing to the channel, And don't forget to click the bell button to be notified.